This conference will now be recorded.
Okay. Yesterday we started the asphyxiants. Already we discussed about what is the asphyxiants. So the drugs are any poisons or any substance which cause the asphyxia in a person when exposure to these substances, gas or liquid, whatever it may be. Those are known as the asphyxiants, and it may lead to the asphyxia and death of the individual. So in that particularly the asphyxiants are already we discussed about the carbon monoxide, carbon cyanide, and war gas. At the same time, carbon dioxide also is there, and but we will discuss about the very important the carbon monoxide, cyanides, and war gases. So already we discussed about the carbon monoxide sources and what are the common sources and what is the physiology, physiology, how it is combined with the hemoglobin and myoglobin and mitochondrial cytooxidases, and what it leads to the finally tissue anorexia at the level of cellular death may be caused, and this is over. And, so because of it combined with the myoglobin, it may lead to the depression of the cardiac tissue, and it may lead to the sudden stoppage of the heart and death of the individual. So at the same time, next to mitochondrial cytochrome oxidase, it combines, and it may lead to the lactic acidosis and cell death also. So already we discussed about the signs and symptoms and what are the saturation levels. So what is the treatment or management is, you have to remember carbon monoxide is a gas and is so irrespirable. So whenever the person will be exposure to the carbon monoxide, you have to remove from the source of the exposure, and you have to give 100% oxygen therapy by tight fitting masks, and whole blood transfusion is the next one. And mannitol steroids for the cerebral edema, which will lead to the decrease of cerebral edema, and antibiotics for the any infection for the lungs, and avoid similar drugs. So this is the management, and you go for the differential diagnosis. And what are the autopsy findings in case of the carbon monoxide poisoning? Already discussed. Is cherry red discoloration of the skin, mucous membrane, conjunctiva, the typical symptoms or sign of the carbon monoxide. And the second one, that is a blistering of the skin of the dependent parts may be sure due to the cutaneous edema. Internal features of the postmortem findings in case of the carbon monoxide is the cerebral edema and punctiform and ring-shaped hemorrhages in the white matter of the brain. You have to remember, you have to discuss about this. And who is that? You please mute it. And next come to the who is that we are discussing. So next come to the heart and the focal necrosis of myocardium will be seen. These are the typical findings of the carbon monoxide poisoning whenever you do the complete the postmortem examination. So quickly now come to the what is the cyanide. Hydrogen cyanide is a gaseous state. Hydrocyanic acid or prussic acid is a liquid state, and salts of cyanide appears as white crystalline powder. This is the solid state. These are the three forms of the cyanides, and the order of the cyanide will be bitter almond taste, and taste of the cyanide will be bitter and burning. Already we discussed the plants. What are the sources of the cyanide part? The present as a cyanogenic glycosides like amigadilin is the variety of plants, and example cherries, apricots, and apples, pear, and bitter almonds, and root of cassava plant. So these plants is the rich source of the cyanides, and 100 grams of the crushed apple seeds equal to 70 milligrams of the hydrogen cyanide. See, the apple seeds itself, if you take the ingestion, no problem. But whenever it is the crushed seeds, the powder will be 100 grams will be equal to the 70 milligrams. It is a poisonous one. And also the glycosides by the digestive enzymes release the cyanide in the GI tract. So it is a natural process. From the combustion, exhaust smoke of the vehicles, cigarette smoking, wood smoke, and smoke from the burning plastics. So may release these hydrocyanic gas are used. And come to the what is the uses of these cyanides. So they may be used in the solid, liquid, or whatever it may be. They may be used in the industrial purpose of electroplating and metal processing, and photograph processing and manufacture of the synthetic rubber and plastic. Next, agricultural uses, they may be used in the manufacture of insecticides and rodenticides. And the therapeutics, sodium nitrate is the useful. So come to the metabolism of the hydrogen. Whenever the person is exposed to the hydrogen cyanide, maybe ingestion or inhalation, whatever it may be, the ingested cyanide salts release a hydrogen cyanide due to the action of the hydrochloric acid in the stomach, and subsequently the cyanide ion is absorbed. Is the ingested cyanide. The metabolized in the liver and kidneys by the mitochondrial enzymes like rhodinase to thiocyanate. So thiocyanate is a stable product in the metabolism, and some part is converted to the cyanocobalamin, and the some parts is excreted in breath and sweat, producing the characteristic bitter almond odor. So whenever he is ingested the cyanide or he may be inhaled the cyanide, what happens is the maybe due to the action of the hydrochloric acid in the stomach, and subsequently the cyanide ions will be absorbed. Metabolized in the liver and kidneys by the mitochondrial enzymes like rhodinase, it may be converted to the thiocyanate. Some part of converted into cyanocobalamin and some parts will be excreted in the breath and sweat. It shows the bitter almond odor. The typical metabolism of the cyanides when you are taking ingestion. So now come to the mechanism of action of these cyanide ions, what are released in this blood. It blocks the electron transport chains. This is the entrance question you have to remember, all of you. The cyanide ions, it blocks the electron transport chain at the level of the cytochrome C oxidase enzyme. So these two are the entrance questions you remember. Blocks electron transport chain at the level of the cytochrome C oxidase enzyme. So it prevents the uptake of oxygen for the cellular respiration. So ATP synthesis and oxidative process will be affected, leading to the cytotoxic anoxia. Isn't it? So cytotoxic anoxia will be appeared in cell death and the death of the individual. Is the typical mechanism of this whenever the person exposed to the cyanide. Okay. So come to the other actions. Metabolic acidosis due to the accumulation of the lactic acidosis due to the formation of the lactic acid in the body by the cyanides. The neurotoxic effect due to the inhibition of the antioxidant enzymes like catalase and glutathione reductase and glutathione dehydrogenase and superoxide dismutase. These are the enzymes which are inhibited by the cyanide and may lead to the neurotoxic effects. And metabolic acidosis may lead to the metabolic acidosis due to the formation of the lactic acid. Now toxic. Hydrocyanic acid concentration of the 300 milligrams for the M3 parts in air will kill the human in 10 to 60 minutes. So 300 milligrams for the M3 meters cube, and in air will kill the human in 10 to 60 minutes. Suppose the hydrocyanic level toxicity 30 to 100 milligrams per M3 in the air will be killed in 1 minute. So spontaneous death will be occurs, depends upon the concentration of the hydrocyanic okay. Hydrocyanic acid is 50 to 100 mg, the fatal dose, and cyanic salts are 100 to 200 mg are very toxic to the human body. So come to this is the fatal dose. Okay. Now come to the fatal period. Hydrocyanic is 1 to 5 minutes. Maybe person will be survive only 1 to 5 minutes. He will be died within the 5 minutes. And potassium cyanide and sodium cyanide will be half an hour. It will take the less toxic compared with the hydrocyanide. Potassium cyanide and sodium cyanide will be compared to the hydrogen cyanide. It will be less toxic. It will be takes half an hour to death. So come to the point of view signs, and what are the signs and symptoms of the person who is exposed to the cyanides. The most rapid of all poisons inhaled gas is instantaneous. So ingestion is the process you have ingestion and the digestion absorption. These process will take some more time compared with when the person inhale the gas is formed. It is instantaneous death. Instantaneous lead to the death. All symptoms reflects cellular hypoxia. All symptoms will be reflect the cellular hypoxia in case of the cyanide poison. So come to the what are the signs and symptoms of the systems that are affected due to the cyanide poisoning? First of all, CNS symptoms already told. The enzymes will be blocked, will lead to the headache, vertigo, dilated pupils, faintness, confusion, drowsiness, cramps, twitching, convulsions, coma, paralysis, and stupor. They are these central nervous systems that will be affected under the cyanide poisoning. Come to the cardiovascular system. Initially hypertension with a reflex bradycardia, but later tachycardia with hypotension and collapse. So it continues to beat for the some time after stoppage of the respiration. So first of all, initially it is a hypertension with a reflex bradycardia, but later it tachycardia with a hypotension and collapse. Come to the GIT, gastrointestinal tract. What are the symptoms? So whenever ingestion takes place, the burning taste will be there of the cyanide poison, and constriction and numbness of the throat, and nausea and salivation will be appear. These are the first symptoms when the person will be ingested the cyanide. Next, respiratory symptoms. The bitter almond odor will be there, and initially the tachypnea, but rapidly progress to the slowing of the respiration with the distress and cyanosis shows. So next come to the skin. The brick red color of the skin and the mucous membrane due to the increase in the hemoglobin saturation in venous blood because of the decreased oxygen utilization by the tissues. So cellular hypoxia will be there because of this. Cytochrome oxidase will be stopped at the cellular level. Electron transport may lead to the cell hypoxia. So the brick red color of the skin and mucous membrane due to the increase in the hemoglobin saturation in venous blood because of the decreased oxygen utilization by the tissues. So that may be the typical finding of the skin, the brick color of the skin. And next come to the what is the treatment for the or management for the cyanide poisoning or the exposure to the cyanide. So stabilization, first of all, it is assisted ventilation, 100% oxygen, cardiac monitoring, treatment of the metabolic acidosis, and IV steroid. See, these are the gases for suppose cyanide gas if we expose. Immediately have to remove him from the exposure place and give 100% oxygen. And you go for the cardiac monitoring and the treatment of the metabolic acidosis treatment IV fluids. So next decontamination, remove the cloth and the skin washing with the soap and water, and stomach wash with the 5% sodium thiosulfate, the activated or charcoal. Isn't it? This is the decontamination and stabilization. The principles of the antidote therapy comes through. It reverses the cyanide cytochrome formation by converting the hemoglobin to methemoglobin. So the methemoglobin has a higher affinity for the cyanide. So automatically it may be removed from the combination cyanide and it may be from the methemoglobin. So treatment, inhalation of the amyl nitrate in a cloth over the patient's nose 15 to 30 seconds until the IV treatment will be started. So what happens if you take the gauze piece also, gauze piece and take and just expose it to the amyl nitrate drug, and it will keep close to the mouth and nose to the this cloth which is exposed to the nitrate, amyl nitrate, and for the at least minimum 15 to 30 seconds it will be inhale it until IV treatment will be started. So IV sodium nitrate are 0.3 grams in the 10 ml of sterile water. Slowly over the 5 minutes you have to give IV. So first of all, you have to inhalation of the amyl nitrate for 15 to 30 seconds. Immediately IV sodium nitrate will be started 0.3 grams in 10 ml sterile water slowly over 5 minutes. And next come to the IV sodium thiosulfate. This is 25 grams in the 50% solution over a period of 10 minutes. Repeat if recovery is not there. See here, remember the entrance question is what is the antidote for the cyanide poisoning. That is amyl nitrate, you have to remember first. Amyl nitrate is the one of the antidote for the cyanide poisoning. And next to the remaining treatment is sodium nitrate and sodium thiosulfate. See, hemoglobin is the name here combined with the nitrates. It forms a methemoglobin. So methemoglobin is very affinity towards the cyanide, which is available in the blood. That is exposure by the person. So methemoglobin combined with the cyanide and it forms the cyanomethemoglobin. And these are the less toxic. comparatively. The cyanide and the thiosulfate like the thiocyanate, isn't it? So this conversion will be occurs and less toxic converts maybe forms. Isn't it? When you are giving the amyl nitrites. So the treatment of the yes. So come to the cyanide kit. So immediate in generally whenever the person is exposed to gaseous, or some people they maybe wanted to take the cyanide as a injection. So but the cyanide kit is it consists of 2 ampules of sodium nitrite and 1 vial of the sodium thiosulfate and 0.3 ml of amyl nitrate as inhalant. Agent. This is the cyanide kit under. First of all, amyl nitrate as inhalant you have to give. Then after that, 1 vial of the sodium sulfate and sodium nitrate you have to give. Already we discussed in that treatment. So cyanide kit you have to remember is the entrance question also. Cyanide kit consists of the 2 ampules of sodium nitrate, 1 vial of the sodium thiosulfate, and 0.3 ml of the amyl nitrate as inhalant. So this is the cyanide kit. So come to the remaining continuous treatment. Hydroxycobalamin, vitamin B12 is the precursor. You have to give 4 grams IV. So this hydroxycobalamin combined with the cyanide and form the cyanocobalamin, which is a large toxin, and it may be excreted. So next, cobalt EDTA as a chelating agents. You can use this, and alpha ketogluteric acid. It binds with the cyanide and makes it non-toxic without inducing the methylhemoglobinemia. Another one, alpha ketogluteric acid also. Methylene blue is another antidote, or but they never used in this treatment. Methylene blue because of its has its side effects. This is the treatment of the cyanide poisoning. Come to the autopsy findings. What is this? So the person is died because of the cyanide poisoning. Now what are the autopsy findings? External findings, especially odor of bitter almond will be there. From the person you will get the odor of bitter almond, already we discussed. Eyes may be bright and glistening, prominent with the dilated pupils. The eyes may be bright, glistening and prominent with the dilated pupils. The froth at the mouth maybe appears, and potassium cyanide and sodium cyanide produce the corrosion of the mouth. If the person is taken as a poison injection of the potassium cyanide and the sodium cyanide, it causes the corrosion of the mouth. Next, brick red color of the skin and mucous membrane will be there. So in case of the cyanides, carbon monoxide is the bright red or pink color. This is the brick red color of the skin and mucous membrane is the one. Come to the internal organs. Internal findings of this, the odor of the potassium, that means the hydrogen cyanide is definitely it is a bitter almond on opening of the body, well marked the brain tissue. So whenever you open the skull and thorax and abdomen, you will get that definitely odor of the cyanide, especially the brain tissue will give the bitter almond smell. Next one, the blood stain froth in the trachea. You can observe as in the final event, it is the respiratory failure. Definitely the blood stain froth. The pulmonary and the cerebral edema you can observe, and the mucosa of the stomach red, congested, and in case of the potassium cyanide and the sodium cyanide may be eroded and blackened. Mucosa is in generally this poison is congested, no doubt, but in case of the potassium cyanide and the sodium cyanide, it is eroded and blackened. The spleen is the ideal specimen for the cyanide analysis, as it has the highest concentration of the poison, moving to strong presence of the RBCs. So this is the entrance question. Remember, spleen is the ideal specimen for the cyanide analysis, as it has the highest concentration of poison moving to the strong presence of the RBC. All vessels of the body contains oxygenated blood, isn't it? So these are the internal findings of the cyanide poisoning. Whenever you open the skull and thorax and abdomen cavities. See, what is the medical importance of the cyanide? Generally, hydrogen cyanide and potassium are usually used for the suicidal purpose. So immediate death, imminent death will be occurs, especially the cowards and Naxalites coverts and international, that means spice gouge. They will be use this the hydrogen cyanide immediately to get the immediate death. Potassium cyanide and hydrogen cyanide usually are the suicides. Action in those who working in the industries which release the potassium cyanide as the products. Rarely go for the homicides. As the method of judicial execution in some states of USA, they may be use the cyanide as a death agent. So they may be form a gas chamber in that the cyanide gas will be released. So because of that, cyanide gas immediately he may be died within a short time. And it is used by the Nazis for the mass murder of the Jews. This is previous at the time of the Hitler's time, they may be Nazis for the mass murders of the Jews. They can be used this cyanide gaseous forms, especially. So this is the medical legal importance of the cyanides. Remember, in toxicology, most of the topics will be you have to byheart it. So there is some mechanisms are there. We will explain to them, and you go through the textbooks, and you number of textbooks. The better one to get the more number of matter about this toxic. That is toxicity because of this poison. Number of poisons you have to collect it. Especially Pillai toxicology is there. Pillai, especially on the toxicology, Pillai you wrote the textbook is there. You go for that, and not only Narayan Reddy, and you go for the Pillai textbooks for text only toxicology, only toxicology. So ఇజ్రాయల్ ఎక్కువ శాతం మనం బయాట్ చేయడానికి ఉంటుంది, but you have to try to mug up and you have to remember that some mnemonics పెట్టుకొని అట్లా గుర్తుంచుకోవడానికి ట్రై చేయాలి. So come to the war gases. This is the war gases used in the war to kill the enemies, especially to paralyze the enemies. They will be use the nerve gases. So nerve gases action similar to the organophosphate. Already you read and complete the organophosphate poisoning. So most toxic chemical warfare agents are example tab, sarin, soman, V and VX and VM. These are the war gases, nerve gases, especially used in the nerve wars to kill the person or to paralyze the enemies. They are heavy. These gases will be heavier than the air, so that they sink into the valleys, basements, and trenches where the enemies have the shelters. So they will spray this gas, and they will go and they will settle in that sink into the valleys, and these people will be killed. So treatment is similar to the organophosphorus poisoning, especially atropine, and remove the person from the exposure, and again you go for the organophosphate poisoning treatment like atropine and reactivators, isn't it? So war gases. So crowd controlling agents. So in case of the people who are going to hunger strikes, Ghani strikes, so to control these people, so crowd controlling agents, for example, tear gas. So that is the chlorbenzyl and melanonitrate. It is used mainly for the police and militaries to control the people who are doing the strikes and mass to control the people, and mass the pepper spray. Mass is the pepper spray used for the to protect themselves and to control the crowd also. So now, what are the symptoms that when the person is exposed to tear gas, mask, pepper spray? So eyes are burning or stinging pain, tears, and blepharospasm, and temporary visual impairment. So by that, you spray the pepper spray. By that, the person will get the burning and stinging stain and blepharospasm. Temporary visual impairment, you can escape. Like that, females when their sexual assault is there, a female can spray the pepper spray and they can escape. Chances to symptoms. The nose and mouth burning and stinging pain and increase the secretions. So the effects are rapidly produced and also last within the 10 to 15 minutes. So by that only, these are used to control the crowds, especially, and the people who are in a sexual assault. They can escape from the saline. They can spray the pepper spray and immediately they can escape from that area. So treatment is automatically it will be if you expose it to fresh air or washing with a 5% sodium bicarbonate or water with water. They can easily treated and it can come to the normal state. So these are the war gases are controlling gas. Other important asphyxiants you can see. Methyl isocyanate. These are typical or and this is the important incident that occurs in the previous in 1984. Methyl isocyanate (MIC). So it involved Bhopal gas tragedy. The Bhopal gas tragedy. So in MP, Madhya Pradesh, it is 1984. More than 2,000 are killed in, and more than 1 lakh are injured in this that means Bhopal gas tragedy. In the factory, it is releasing of these gases because accidentally. So people are 2,000 dead, and more than 1 lakh are injured in this. So this is a historical one, and you have to find Bhopal eye syndrome. So increase the incidence of the trachoma and lead infections and other ocular-related symptoms in exposure to population. So like that, methyl isocyanate, you have to remember that is a Bhopal eye gas tragedy in 84. So what are the gas that is released in this methyl isocyanate in that accident? Okay, anyway, so we finished with this the asphyxiants. You go through the textbooks, any carbon dioxide, the small gas are there asphyxiants. You go through the textbook and you have to buy it. Already I told, just you have to remember the mechanism and metabolism. Then and remaining symptoms are you have to go through the textbooks and mug it definitely, and you form a mnemonics for that. Signs and symptoms are typical poison. Then only you have to remember a number of times you have to read it and you go through the textbooks. With that, we finish the asphyxiant. With another topic, we will come. Thank you, and you can leave it.